Okay, hi everyone, and welcome back to MS Neuro TV, brought to you by MS Fusion News. My name is Ana Fernandez de Castro, the Assistant Development Coordinator at MS Fusion News, and I'm here today with our Director of Development, Jennifer Falk.
Good evening, everybody, and welcome.
So, MS Fusion News is a nonprofit organization dedicated to providing education and information to the multiple sclerosis community. And before we go any further, we would like to thank our supporters, Celgene, and viewers like you for making educational programs like this possible. We are here today with nurse practitioner and MS specialist Patricia Pagnotta, as she shares with us her insights on common issues faced by women living with multiple sclerosis, including hormonal changes and how they can affect multiple sclerosis. Patricia, or Tricia Pagnotta, is currently employed at Neurology Associates and the MS Center of Greater Orlando in Maitland, Florida. She completed her undergraduate degree at Towson State University in Towson, Maryland. Her graduate degree was completed at the University of Maryland, and she did postgraduate work at the University of Central Florida. Tricia is an active member of the MS community. Currently, she is the president of the International Organization of Multiple Sclerosis. She is a member of the Consortium of Multiple Sclerosis Center and serves on the Southern Regional Healthcare Provider Council. Tricia has published in MS in peer-reviewed journals and patient journals. She has been active in research as a primary investigator and co-investigator on several clinical trials in multiple sclerosis. She is very active in educating on multiple sclerosis to peers and those affected by the disease, and has presented all around the United States. She is an advocate of people affected by MS and runs a monthly support group for MS patients in Central Florida. On her spare time, she loves to be with her family and animals. All right, so we'll start tonight by playing a special video interview with Patricia Pagnotta. After the video is done playing, we will be live with Patricia for a Q&A. If you have any questions that you would like to ask Patricia about women's health and MS, go ahead and type them into the question box. We will keep your questions anonymous. And for those of you who are calling in over the phone tonight and do not have video access, please know that you will hear a few minutes of silence while we play the pre-recorded video interview. But please don't worry, stay on the line, because once the video is done playing, you will be able to hear us again during the live Q&A with Patricia. Okay, let's begin.
Neuro TV, presented by MS Fusion News. MS Neuro TV is a comprehensive educational program bringing together MS professionals from across the United States, covering the topics that you want to learn more about. To register for MS Neuro TV webinars, visit www.msfusionnews.org. Thank you. We hope you enjoy the program. Good evening, Tricia, and welcome to MS Neuro TV. Thank you for being here with us this evening.
Oh, thank you for having me, Jennifer.
Absolutely. Tonight's topic is women's health and multiple sclerosis, and women living with MS are presented with many challenges including managing family life, work, career, and relationships, just to name a few things. But women living with MS also have questions related to uniquely being a woman, including things like intimacy, menstrual cycle, pregnancy, and menopause. Can you share with us the statistics first of how many women versus men are living with MS or diagnosed with MS?
It's a 3-to-1, 3 women for every 1 man. So definitely a predominantly female disease.
Okay, thank you. And can you please share with the audience recommendations for women living with MS who are premenopausal or currently in menopause? Can menopause affect one's MS, and is hormone or estrogen replacement an option for people living with MS, women living with MS?
So premenopause, when you look at women who premenopause, the estrogen levels are typically higher. And so we have found that estrogen sometimes is protective in MS. We've tried to replicate that and have not been successful in replicating what the body's natural estrogen does. But even women who are premenopausal can run into difficulties around their cycle times. Typically, about a week prior to the onset of their menstrual cycle, will notice that some of their MS symptoms get worse. They might notice that they have more balance problems, more fatigue, more cognitive difficulties, maybe moodiness. And so it just depends what their MS symptoms are. So some persons may think, well, gosh, that happens to regular women. Well, yeah, persons who have MS are still regular women. So the things that can happen to regular women around their menstrual cycle will happen to persons with MS. But the issue with persons with MS is they also have a neurologic disorder. And when things upset their body, that can make it harder for their symptoms of MS. And so they might be more apparent. And that might not be visible to other persons. Just like when the week before your menses, not everybody in the office or at work or your family knows it unless you're advertising it, but you're going to feel it, and you're not going to feel as good about yourself. It's going to make you harder. So it does present quite a few challenges. And one of the challenges is that persons don't see it, and so therefore many persons, well, it's just in your head, or, you know, oh, you're always complaining. So you really need someone that can be supportive, and so I think that that's a challenge for women. So women who are postmenopausal, we know that the estrogen level drops, and so roughly about 50% of women describe that their MS is worse postmenopausal. And so there's scientific evidence for that because of the estrogen drop, and there's other things that occur to women in their postmenopausal time, whether they have MS or not. Fatigue, some persons don't sleep as well because of hot flashes. They become more heat sensitive. Well, if you have MS and you're already heat sensitive and then you're having hot flashes, women, postmenopausal women, have more difficulty with the fact that they don't sleep through the night and might be getting up a couple times to go to the bathroom. Then you add that on top of having MS, and maybe you have already urinary issues, and so those symptoms that would happen to any person going through menopause will be more difficult for a woman who has multiple sclerosis. And hormone replacement is an option for any woman. That's something, though, a person needs to talk with their own provider about and make a decision, because we know that hormonal replacement has its own risk, that there are hormonal replacements that can put you at higher risk for stroke. So just depending upon other medical conditions. But there's other things other than hormone replacement. There's a lot of antidepressants that are very good to help women going through their menopause, and so that can be helpful. There's natural supplements that can help regulate hormones, and so you know, bioequivalent type of things, and those aren't as harmful. So I would encourage a person to talk to their GYN, because there are things that can help persons. So.
Oh, excellent. Thank you. I think that's going to help a lot of people and answer a lot of questions. So MS is often diagnosed in the prime of a woman's life. Can you discuss with us MS and pregnancy, during pregnancy and after pregnancy, recommendations and what women may experience during this time of their lives?
Well, the good news is that MS does nothing to affect a woman's fertility. So if a woman doesn't have difficulties becoming pregnant, then she's not going to have a difficulty because of her MS. Now, studies for men is not the same. Sometimes men who have MS, their sperm counts are lower. So, but for women, there's no data saying that women will have any difficulty getting pregnant. So that's one thing, that's good news. The bad news is that depending upon where they are with their MS, getting pregnant is something that they really have to think about. So if your MS is very well stable, very well controlled, you have been doing well on a disease-modifying therapy, and you want to get pregnant, well, that's probably the best time. And most of the time during pregnancy, that's a protective time for women because, again, the estrogen levels rise, and the majority of women will not have relapses during pregnancy. And Mark, I said the majority of women. Not every woman will go through pregnancy and not have a relapse. So it's something, again, you can't not see your neurology team. You have to keep in contact with your neurology team and let someone know if you have symptoms. But the majority of persons will do well. And talking about whether or not you stay on your disease-modifying therapy, that's very controversial. In some countries, they do not take women off of disease-modifying therapies when they get pregnant. Here in the States, we do. We typically do not, but I have known of some persons who, with the guidance of their neurology team, will make that decision to stay on a disease-modifying therapy. And again, I think that the decision-making in doing that is based off of an individual's, A, what drug they're on, what are the known risks of that, you never know all the risks, but also where are they in the disease process, how severe is their disease. And that's something you need to take into consideration even prior to getting pregnant, because your disease may not progress while you're pregnant, but you still have to consider that the needs of you increase after pregnancy, because not only then do you have yourself to take care of, you've got a baby to take care of. So you need to really assess your support system if you're a person who has some disability. Again, although you might not relapse during pregnancy, if you're a person that has some disability, the pregnancy weight gain can cause difficulties with balance, urinary problems, the sleepless nights. Most women who are pregnant, you have an increase in the blood flow, and most women feel very warm during their pregnancy. Very few women complain of being cold during pregnancy. And so already most persons with MS have a heat sensitivity, so that's going to be even more dramatic. And so then some of your symptoms may come back. You may not be having relapses, but you have a lot more symptoms. It's hard to sleep in your later trimesters because you're getting big, and sometimes you can get carpal tunnel if you retain fluids. So again, the things that would happen to any person can happen, but with a person who has MS, those might affect you more significantly. So just again, good prenatal care, good GYN, OB, and sticking with your neurology team. But I would not say that women should say, oh, I have MS now, I can't have children. That is far from the case. I mean, it's truly a decision that a person makes, and ideally they make it when they're stable, because you don't want to risk more than what you have. Because after you have your child, that postpartum period is when you're most likely to have a relapse. When your hormones are readjusting, there is some protectiveness about breastfeeding, but that's not as high as pregnancy. So most of us say, well, we would like women to be able to medically give their baby what the baby needs, and that's a month worth of breastfeeding. After that, then it's constant reassessment of risk-benefit of how long a person breastfeeds. You know, the good thing is some women can breastfeed and pump at the same time, and in a month of breastfeeding, they could have 2 more months worth of breast milk. So again, those type of decisions are made on a one-to-one basis, but knowing that you're at most risk in your postpartum period would suggest that if you have a more aggressive course before getting pregnant, or if you're more disabled, that you might be sooner to go back on your disease-modifying therapy than stay breastfeeding for a longer period of time, just because of the risk that you would have of potentially relapsing.
Excellent, thank you. Thank you for sharing that with us. Can you please share with us common concerns and questions regarding intimacy, sexuality, while living with multiple sclerosis?
So I think one of the biggest problems that both men and women have, but women much more, is just a body image. You know, having MS means that some women feel they're flawed, they're not normal, they're not like every other woman, and even if they don't have visible symptoms, they have those invisible symptoms that are as dramatic as maybe the visible symptoms, the constant not feeling, the cognitive difficulties, the difficulties with sight. But the feeling sensations can be particularly difficult, because if you don't feel and sense things the same way, it might be harder for you to be engaged or to have the same pleasure. The body image, again, getting a healthy body image and finding a supportive partner. But first you have to believe that you are good and that you are attractive, and then you can pass that on. After that, I think it's, you know, depending if a person is disabled, then there's lots of ways that you can look at different positions, and persons who have sensory issues, again, exploring with lots of different foreplay. There's lots of tools that you can use. I mean, you can go to any number of toy stores, or they have online parties. They have all kinds of things that you can get. But I would tell persons, you know, the real thing is exploring and you know, finding what works for you, but having someone that will help you with that. And there's persons that will counsel women on that. So if you're having difficulty and you're embarrassed about that, then seek help, because that is an important part of a relationship. And it's as important for the female as it is for the male. And in order to have a healthy relationship, it's really something that persons should be able to have. And many times I hear persons tell me, well, it's not that important. Well, it is. And maybe it's not the act of sex, but the act of intimacy is so much more. The act of cuddling, hugging, all of those things. And so maybe the actual consummating sex doesn't happen as frequently, but the intimacy should be there on a daily basis. Everybody needs hugs and kisses.
Thank you. And can you share with us issues specific to women's health that you see most frequently in your practice, either it be in relating to work or life or relationships or the balance or the juggle? What do you find is the most common theme for women living with multiple sclerosis?
I think the most common theme is the thing that most women struggle with as a whole. They have to do it all. I have to be a mother, a wife, a sister, an aunt, an uncle. I work. Very few persons nowadays can live without a two-person income. And then I have to be a housekeeper and do everything. So it's that wanting to desire, want to have and do everything. And women are not real good as a whole at delegating. Certain things in their professional work life, yes, but when it comes to home, I find very few women are as good as delegating, and they feel, most women that in my practice when they're talking about this tell me that they feel that they haven't been successful if they have to ask for help. And trying to get a woman to understand that the persons around you want to be able to help you, and accepting help is a gift that you're allowing persons to help you with. But that's the biggest challenge, is how do I juggle it all and feel like I'm doing what I need to do as any other women would.
Well, thank you so much, Patricia. Thank you for being with us.
All right, thank you. Thanks.
Well, hello everyone and welcome back. This is Jennifer Falk, and I just want to thank Tricia. That was a wonderful interview that she gave us. So now it's time. Yes, absolutely. It's time for you guys out there. We have a lot of people on the line tonight. You can start typing in your questions. You should see the question box on the top right-hand side of your screen. If you don't, there should be an orange arrow. You can click on that arrow, and it'll make the box available for you to type in any questions that you have for Tricia. I would like to try to get to as many questions as possible tonight. We're excited to hear from all of you. And please remember that no question is ever silly, and all questions are an opportunity to learn, not only for you, but for the hundreds of people who will be watching along and might be wondering the same thing. So I encourage you to really think about your questions and try to keep them related to tonight's topic, to women's health. And it's going to be a great session here. So without further ado, I'd personally like to welcome Patricia Pagnotta tonight to MS Neuro TV. Thank you, Patricia, for being here with us.
Oh, thank you, Jennifer. I appreciate the opportunity to talk to everyone.
Oh, great. Absolutely. And we do have a lot of questions coming in, as I said. I'm going to just start. Here's the first question. I know you spoke a lot about menopause. How common is it for women to be diagnosed with MS after menopause? This person is saying, my symptoms became much more apparent after menopause, which is when I was diagnosed. Do more women get diagnosed with their MS before or after menopause?
So that is a good question. More persons do get diagnosed with MS before menopause, because typically menopause in most women does not begin until their late 40s or beyond. The average person starts menopause in their 50s. So most persons with MS are diagnosed between the ages of 20 and 40. What some persons experience is that the symptoms of menopause may bring them to the doctor for the first time, because prior to that, they were busy women taking care of children, family, and doing things, and may have passed off some minor symptoms that, and then menopause comes and those symptoms are more severe than they were before, and that's when they go to a healthcare provider and get the diagnosis. But officially, more persons are diagnosed prior to menopause.
Okay, that's interesting. And there's more questions coming in about this topic. I wanted to know if my recent issues with fatigue, which I never had before, could be related to menopause. I guess so, the question could be related to, how do I know what would be related to my MS or what would be related to menopause or possibly aging?
That's a good question too. So if you've never had fatigue before and your MS is stable, your MRIs are unchanged, other disease, disability symptoms are unchanged, then you always have to start investigating things that are more common. Fatigue is very, very common in persons who are going through menopause for a multitude of reasons. Your hormones are changing dramatically, and that can cause persons to be fatigued. The other thing is many persons, even if they're not having hot flashes or night sweats, many persons don't sleep as deeply and get into REM sleep as when they're first going through menopause. So if you're not getting rest, then you're going to be more fatigued. And there are many women who suffer with mild depressions because of menopause. And one of the cardinal features of depression is fatigue. So MS is rare. And if you've not had fatigue with your MS and your healthcare provider neurology team thinks your MS is stable, then it's more common that this could be menopause related and you should see a GYN and have that evaluated. And many persons, their primary care doctors are sufficient at evaluating that.
Okay, thank you. We've hit a hot topic, no pun intended there, but I have someone else here. That was good, right? Do you think that menopause comes on a lot earlier for women living with MS than it would normally come on? And if so, what is the usual timeline?
Well, I don't have any data that says that menopause comes on earlier for women who have MS versus women who do not have MS. And I think what happens for women who have MS is that menopause symptoms affect them more severely because you already have a chronic disease that it doesn't take much for your MS symptoms to become more active. So when you're having those hormonal changes and then the sequela of that, which could be not sleeping well, having mood disturbances, weight gain, feeling fluid buildup, all of those things can make your MS symptoms worse. So the severity of symptoms of menopause are typically worse in persons with MS, and then often make them feel like the menopause itself is actually lasting longer, because if those symptoms are not treated, they can become symptoms that transition to part of their MS symptoms, not just part of menopause.
Okay. That's interesting. So I'm going to hit one more menopause question here. So this person is asking, during menopause, if my MS symptoms feel or are being experienced as worse, does that mean that I'm actually progressing and getting more lesions or having more active disease?
So menopause will not cause your MS to physically be worse. So menopause will not cause new MRI lesions. It will not cause permanent disability. But again, your symptoms could be worse, and you could be experiencing what we call UTOF phenomena or pseudo relapses, in that when you're having a hot flash, what's really happening is that your body temperature is going up a little bit. When that's occurring, your MS symptoms could become more active. In other words, many persons who have had an optic neuritis in the past, let's take that one symptom, when they get overheated, they will have some blurring of their vision and have difficulty with their vision. And so if you're having that symptom occur more frequently and you're having hot flashes, then that is not really true disease. It is just the symptoms are being aggravated by menopause. So typically your neurology team in combination with your GYN are able to sift through this and really determine what is MS and what is not. MS disability is not something that come and goes. comes and goes. If you're becoming more disabled, that's something that is there all the time. So that's the thing. Menopause symptoms will fluctuate and disability does not.
Oh, thank you. Okay, that was very clear. All right. We're going to shift a little bit towards pregnancy. What if you mentioned pregnancy in MS? What if you do have a relapse during pregnancy? What is the protocol or the treatment that would be done at that point?
Well, depending upon the severity of the relapse. So most OBs do not find that steroids are particularly offensive or problematic in giving persons as far as the unborn child. But the risk of steroids in a person who has MS is that you could gain weight, you could retain fluid, and in certain parts of pregnancy, and especially in women who are more likely to become toxemic in their pregnancy, if you give them high-dose steroids and they start developing fluid retention, and that then causes them to have premature labor, that would not be a good thing. So what we look at is the severity of the relapse. If it's a mild relapse that is not causing significant impairment of function, then the benefit of giving the steroid might not outweigh the potential risk of pregnancy, although in most persons it's relatively safe. So it really is an individual decision that is made with the consultation of the GYN, the OB specialist, and most persons, despite the fact that they don't need it, are being referred to high-risk OBs. And so that and the neurology team will make that decision. The key is to keep in mind that we have not been able to prove that steroids affect the long-term outcome of recovery after a relapse. So if the relapse is not significant enough to impair your function, and there's any chance of harm to the baby or to the mother, then we would not give steroids.
Okay, thank you. And I have another question in regards to children. If you have MS, or if the mother has MS or the father has MS, how likely would it be that your child would have MS? And does it matter if it's the mother or father? Is there a more dominant inheritance? I think is what they're trying to ask.
Well, that's a very good question. And so there is some genetic tendency for persons to pass on MS to a first generation. So that's a mother or father to their child. There is more effect of the environment than there is genetics. So identical twins, there's only a 20% increase that an identical twin, the other twin, will come down with MS. In persons who are children of parents who have MS, one parent, there's a 4 to 5% increase above the general population developing MS. So if you have two parents that have MS, that probably is a little bit higher. I don't have the exact number on that, but it probably is a little bit higher if you have two gene pools that pull in MS. The incidence of whether a male versus a female gene, females are more likely to have multiple sclerosis. So if your mother has MS, that is more likely if the child is a female, that there's a higher incidence. But if the child is a male, again, it's less likely, but still a little bit higher than general population.
Okay, thank you. And Tricia, this is a question for you. In your practice and in speaking with women and mothers who are living with MS, how do you recommend, or what is the conversation like around speaking with children about your MS?
Well, you know, again, this I really feel like family members are great support persons, and I feel like that everyone knows their family and needs to decide when it's time to involve children. But children are going to know if something is not right in the family and if mom or dad are not feeling well. And it's better for them to have an understanding of what that is than to leave them guessing. So I feel I advise persons to tell their children in a easiest way possible, answer their questions, let them know that you have a disease and that this disease now is very treatable. And I encourage persons to use tools that MS Views and News has, the MS Society has. There are many tools that you can use to help young persons understand this disease. But if, let's say, fatigue is one of your main symptoms and you find that you're not able to participate in some of your children's extracurricular activities, you don't want your child to think you're not doing that because you don't love them or you don't want to be there. It's better that they understand, well, today's just not a good day for me, but I want to be there and I will be there for you when I can, versus leaving them questioning, why is my mom or dad not going to these things? Do they not? So I think it's best to try to be open and honest, and then you'll find your children are supportive. And they, again, it takes a village to take care of persons with MS. And when you're having a bad day, it's nice to have your child be able to help out. And children want to help, and it gives them value to help their parents do things. So I think it's good to engage them for multiple reasons.
It's true. Thank you. Thank you. And during your interview, you discussed body image and how women perceive themselves. The question that's coming in is, what do you feel is the best exercise or movement for women living with MS to help improve body image?
Well, I think that yoga moves, stretching exercises. So whether you do yoga, you do Tai Chi, stretching exercises, toning exercises, not necessarily weightlifting, but stretching and getting your body as limber as you can. That will help manage the spasticity symptoms. That'll help you walk better. That will help with some of your sensory symptoms, and really will be enough to define tone. So you'll have tone in areas where you might think that you have flab. And the other thing is, stretching exercises can be done very easily and they aren't overtaxing. So you're not doing an exercise that you feel like you can't be successful in, because many women, I'm sure some men, but many women are very self-critical of themselves. So if they start an exercise program that they can't accomplish, then that's just another thing to, make them feel bad about themselves. So I think stretching is very doable and is very beneficial.
Absolutely. Thank you. And I'm going to wrap it up with one last question. And it's a common question, but in your experience, Tricia, do you have any suggestions on helping symptom management, controlling symptoms through natural supplements, through nutrition, through complementary therapies?
I have a fair amount of experience. I would not say I'm a functional medicine specialist, but I do know that there are complementary medicines that are extremely beneficial, and one of the best is dieting. So I tell persons there is not a diet that will cure MS, but diets do make us what we are. So if you're eating healthy, you're going to be healthier. So I'm not saying that persons should necessarily become plant-based. I'm not saying persons have to become vegans. I'm not saying that persons should only eat a keto-free diet, but persons should be healthy and eat a well-balanced diet. There is a lot more research in general health around the Mediterranean diet as far as general health than any other diet. So if you were to ask me, is there a diet that helps with person's feeling the best, I'd say, well, a Mediterranean diet has the most evidence about that. But a plant-based diet, we know for MS, is a more anti-inflammatory diet, and there's more and more evidence in the functional medicine realm where they're looking at not only MS, but other autoimmune diseases where a more plant-based diet actually reduces the body's inflammation. So the Mediterranean diet has much more plant-based than a American diet. So I would think that the combination of those two would be the best. So that's number one, complementary medicine. Take care of yourself, eat well. Number two, exercise. Everyone should be getting a regular amount of exercise, 30 minutes minimally, 3 to 4 times a week of good, healthy exercise. Stretching, again, should be something that you do every day. Number three, rest. If you're not sleeping well, you're not going to be able to do well during the day. So persons really need to get adequate sleep, not only the time in bed, but good nurturing sleep, REM sleep, sleep that turns their brain off and allows their brain to reset itself and be vital during the day. So those are the top 3 things that I think persons can do in a complementary fashion. Now, are there other things like acupuncture and herbs and things that have been very helpful to persons? Yes, there are. But I think if you concentrate on the top 3, you can move down from there.
This has been excellent, incredible. Thank you so much, Tricia. And you've just brought us a wealth of information in a very quick amount of time. We're very grateful for that. Thank you.
You're quite welcome.
Excellent. And I'd also like to thank all of our participants who were active tonight, who asked their questions, and who were engaged in learning. This has been a wonderful opportunity, and we thank everyone on the line tonight. And I now believe that Anna has some closing statements to share with us.
Great. Thank you so much, Jennifer. And I just wanted to take a moment to share a comment that that somebody left to us during the webinar. One of our viewers says, "I just wanted to say what a wonderful lady. I found everything she talked about most informative. Thank you, Patricia, and thank you, Jennifer, as well."
That's great.
Thank you.
No problem. And thank you so much for joining us tonight, Patricia. You shared so much valuable information with all of us. And thank you to all of you who have joined us today on MS Neuro TV. And we would really appreciate it if you could complete the 1-minute survey that will appear after the webinar is finished, so that we can continue to customize our events around you. Next month's topic is cannabis and MS with neurologist and MS specialist, Dr. Matthew Baker. This webinar will be held on Tuesday, May 7th at 8:00 p.m. Eastern Time. Those of you who are joining us live are already registered for the entire series. So just keep an eye out for our reminder emails for instructions on how to join our next webinar on May 7th. If you are watching us on YouTube and are not registered for this series yet, you can find the registration link in this video's YouTube description. All MS Neuro TV webinars, including tonight's recording, can be found on our YouTube Learning channel within the week. So make sure you subscribe to our channel and turn on notifications so that you can get alerts on our latest MS videos. If you are enjoying these webinars so far, please visit our website and sign up to receive notifications on our free educational events near you. Plus, receive interesting articles on what's new in the world of multiple sclerosis. You can sign up by visiting us at www.msviewsandnews.org and follow us on Facebook, Instagram, and Twitter. This webinar has been made possible with support from Celgene and viewers like you. Thank you for joining us. Have a good night.
Good night.
Good night.